Okay, good evening, everybody, and it's 8 o'clock, and welcome to today's episode of Marvelous Medicine, which is about mentorship needs and how to address them. This idea was born because of a conversation between Dr. Kaveri Banerjee and me, which was facilitated by Patta Radhakrishna. Dr. Kaveri is the founder and medical director of the Advanced Fertility and Gynecology Center, New Delhi. She's the founder member of a program called Beyond Residency, which is for practicing and propagating mentorship. So we got together and we thought we should find out what hurdles young doctors are facing, identify their pain points, because what was true for us 30, 40, 20 years ago, it's not what is mentorship. What mentorship meant to us many years ago is not what mentorship is needed by them. And so we thought we should learn directly from them and try to address them. So Dr. Kaveri created this Google form, which we shared with young doctors to understand their needs, concerns, and expectations, because mentorship is bound to fail if we don't know what the expectations are. So we hope that the information that we collected and today's discussion will help us design a useful mentorship program. So Marvelous Medicine, as many of you know, started during COVID. And the intention was to bring together people across specialties, age groups, and geographies. We also hope that we'll be able to inspire the younger generation who are, constantly under pressure because of NEET and NEET PG and NEET super specialty, and then after that the dog-eat-dog scenario in corporate hospitals, and publish or perish in the government hospitals. So the intention was that we should be able to tell them there is a lot more to life than that, and how, in Ravi Shankar's words, medicine is truly marvelous. But we don't seem to have made the necessary impact with youngsters. So one of the things we hope to do with our website is try and get mentors and mentees together, so that the young doctors can get the help and support that they need. So we have Dr. Ramkumar Venkateshwaran, who's board of trustees, is on the board of trustees and the chief medical officer of Mission Smile, a not-for-profit organization that does cleft lip and cleft palate surgeries free of cost. He is from my alma mater, MBBS, DA, and MD from Dippa Pondicherry. He served in the Department of Anesthesiology at Kasturba Medical College, Manipal, for more than 30 years and retired as the head of the department. He started the first BSc Respiratory Therapy program in India. He's the founder of and director of the Medical Simulation Center at Manipal University, and was also the founder president of the All India Difficult Airway Association. The IDA guidelines were recently updated, and even all international bodies recognize it is one of the best practical guidelines that can be applied anywhere in the world with any infrastructure training. He has several national and international publications, and he has served as the editor-in-chief of Journal Airway. The reason Ram is here today, that he's mentored several generations of anesthesiologists and doctors, and you should see the fondness with which his students remember him, and the glow in his eyes when he sees any of his students doing well. So though he's a regular attendee in Marvelous Medicine, whenever it is any one of his postgraduates or students, he makes it a point to attend the session. So he's a passionate mentor. So that's why he's here today.
Thank you, Vidya. Thank you for that introduction. Thank you.
We also have Professor Sujay Paul, who's the professor and head of the Department of Surgical Gastroenterology at AIIMS Delhi. He's also a founder member of the Beyond Residency program, and his current interests are in hepatopancreatic biliary surgery and liver transplantation. He has over 200 research publications. I recently had the opportunity of bringing out a booklet for commemorating 40 years of the Department of Surgical Gastroenterology at Delhi. And I went through a lot of articles that were submitted by various people who had gone through the portals of the hallowed department. And almost every single person who was there after Dr. Sujay Paul joined had something, really positive and wonderful to tell about him, about how he was so kind and how he was such a great mentor and a teacher and all that. So we are extremely happy to have Professor Sujay with us. Welcome, sir. And as per Dr. Kaveri's thoughts and mine as well, the intention was to put together a panel of young doctors from whom we can learn what they want as mentorship. However, most of these people actually probably can be mentors themselves. They from after going through their CVs, I find that they would be wonderful peer mentors as well. But nevertheless, we'd like to hear from them. So I'll be just going in.
Vidya, you're not introduced Kaveri.
I introduced. First thing I said was about her.
Oh, really? Oh, sorry.
So, so the first among the young doctors is Dr. Amritavarshini Raghavan. And she, after completing her MBBS from Velammal Medical College, Madurai, she passed her PLAB and has received her GMC registration and will be starting her training in Obs and Gynae in the UK soon. She has several, achievements to her credit, but we'll get to those once we actually talk to her. We also have Dr. Dania Epen, who did her MBBS from JIPMER Pondicherry and is currently pursuing her MS Ophthalmology, also from JIPMER Pondicherry. Next in line is Dr. Karthik Nandam. He's again a JIPMER alumni, MBBS from JIPMER Pondicherry, and is currently doing his MCH in neurosurgery, the composite 6-year course. Pulkit Gupta did his MBBS from AIMS Jodhpur, MS General Surgery from PJ Chandigarh, and is currently doing his MCH Urology in JIPMER Pondicherry. So we'd like to hear a lot from Pulkit about how mentorship works in various different institutes. He's gone through three big institutes, so we'll wait to hear from him. Next is Dr. Shaurya Yadav. I wrongly assumed that it was he, but Shaurya did her MBBS from Vardhaman Mahavir Medical College and Safdarjung Hospital, Delhi. She did her MS General Surgery from PJ Chandigarh, and she's currently doing her MCH GI Surgery and Liver Transplantation from All India Institute of Medical Sciences, Delhi. The youngest of them all, or the baby of the group, if you may, is Dr. Siddharth Rao. Siddharth Rao, currently doing his MBBS in AIMS, New Delhi. We also have Dr. Snigdha Soni. We somehow landed up having most of the mentees as surgeons. So Snigdha is currently pursuing her DM in reproductive medicine and surgery at the All India Institute of Medical Sciences, after having done her MBBS and MD also from AIMS New Delhi with a gold medal in MD Obstetrics and Gynecology. She's also a diplomate of the National Board and a member of the Royal College of Obstetricians and Gynecology. I hope Dr. Kaveri is here, and as I mentioned before, this program was her idea, and she made the Google form through which we collected the information. And now I request Dr. Kaveri to present the findings of that survey. Over to you.
Thank you, Dr. Vidya, and a warm welcome to all the mentors and the mentee. And thanks to Dr. Sujoy and Dr. Radhakrishna to get us together and have this forum today evening. Personally, I've always wondered, after all the training, there was a phase in all of our lives where we were not sure where to go, how to do, and if somehow we can help the youngsters. And then the question came, we needed it that time, we felt the need at that time. Do they feel the need now? So we can't address a problem till we're sure that the need is felt. So this Google form, again suggested by Dr. Sujoy, was shared about 6 weeks ago. And we had about 240 people who had responded to this. Can you see the screen, please?
Yeah, yeah, we can see.
Okay. So basically, we were trying to map the transition from training to professional reality and identifying if there is a role for mentorship. This form was a confidential survey aimed at understanding the thoughts and concerns and to design a meaningful mentorship initiative tailored to real needs. This was based on the background of the people who filled the form, what concerns they said they had, the mentorship needs, whether they actually need it and how do they need it, in what form, and what they expect from those discussions. Most of them, since it was circulated at the GI surgery and surgical department of AIMS, and then Dr. Vidya took the initiative, including some from Obs and Gynae department. Most of them, 32%, were in the final year of some form of training, either MD, DM, or MCH. 10% had completed their DM or MCH, 10% had completed senior residency, 14% had completed MBBS, and the rest were in the other category. A vast majority of these 239 were surgeons, about 44%, 7% anesthetists, 10% obs and gynae, and 11% from the medicine unit. The concerns which we asked in the form, the first question was, how clear are you about your next career step? Where 1 was not clear at all and 5 was very clear. So about 70% said they were either not clear at all or just unsure. And about 33% said that they were fairly sure about what they wanted to do. And amongst all these, when we asked them what were they considering, many were considering future training, so either post MD, MS, DM, MCH, and 25% or about 28% each were considering either private practice, government jobs, or going into corporate hospitals. What were their concerns? The biggest concern was, how do I find my foot in the private practice? What are the opportunities in that direction? A similar percentage were yet to make up the career direction. Do they go into academics? Do they go abroad? Do they go into private practice? About 14% wanted to hone their skills more before they took a decision as to what they should do as a career. And similarly, about 12% wanted to study more. 10% were very anxious about how they would go ahead with the current financial situation and in the future when they had families or they went abroad. So those were the main concerns. In practice opportunities, where are the vacancies, which is the location, how to deal with competition. They were not sure about what career direction, skills. They were not sure about confident about the precision of surgical exposure or diagnosis, treatment. Some wanted higher qualification, and as I mentioned, financial stability was a big concern. A few notes from the Google form, which of course there were many out of 240. This kind of stood out. Many students feel they receive little career guidance during undergraduate training. Teaching is often perceived as being replaced by criticism with limited bedside teaching, mentorship, or academic inspiration. Maybe, it may not hold true for everyone, but somewhere maybe a call for more empathetic training environment. As a community medicine graduate, I see limited opportunities outside the government sector and intense competition within it. After years of training, the mismatch between skills, opportunities, and financial returns creates uncertainty. Better career guidance and alignment of training with market needs could help address these challenges. So again, the question went: what did you feel least prepared for? So what were your anxieties, and what do you think you're not prepared for at all? Apart from career, practice setting, maintaining work-life balance, this was a very important concern in many of the applicants. Financial planning came out as one of the strong points where they felt least prepared. When pointedly asked about the mentorship needs, would guidance from senior practitioners or doctors help you at this stage? It was a resounding yes, uh, though many did feel that perhaps they were okay with it, but about 75% said yes, they needed it. Having a mentor would be a tremendous advantage. Seeing a senior who has navigated the journey successfully is inspiring in itself. Having that person as a mentor would be invaluable. So, somebody to guide them through the initial stages. When the preferred format was asked, a vast majority, half of them said they wanted a one on one mentorship. So, this is kind of important where maybe the young doctors, residents may not feel comfortable in taking out all their concerns in a general forum. Many said a small group would also be all right, and 17% did say that group sessions and webinars are fine. What do they want to hear from us? They want to hear mainly about decision making, which way to go, the corporate way, the research way, pure academics, private practice. Real life challenges. This came out very big in all the form that they wanted honest experiences. They wanted to know how to survive in a competitive environment with examples, personal journeys, tough times. They also wanted, many felt that they were not yet ready to get on with, treating patients, and wanted tips from mentors as to how to deal with difficult cases, how to improve, how to handle complications. Financial planning, again, what would should be the salary if they join the corporate, how should we negotiate, what should be the financial growth. I mean, definitely these are things that were never taught to us, and most of us have learned it ourselves. Work life balance, positively has come out as a very important factor, and I feel the generation really is giving importance to what matters. And so work is good, but how also to balance everything. They wanted to know from the mentors how they did it, if they did it at all. That was a good question. What was the mistakes, what were the regrets, what would they tell us that we should not do, and the do's and don'ts, the setbacks, etc. Finally, so we asked them, would you be open to being contacted for our future sessions? And again, a vast majority said yes. And this was again from one of the person who filled it, and I think it addressed all the points they wanted. More empathetic training atmosphere, what's worked for the mentors, how was it initially, how were the finances managed, how did they do the work life balance, how did they choose the right specialization, and how did they handle mistakes. Finally, the training does, it's a highly structured and scientifically rigorous process. However, while clinical mastery is achieved, holistic life and career mastery is entirely unaddressed in the curriculum yet. Nearly 1 in 2 emerging practitioners lack confidence in the foundational pillars of sustainable medical career, and I think there is a huge want and lacuna here which can be addressed together. To conclude, most expressed desired for mentorship. The preferred modality was one-on-one mentoring or small group interactions. They wanted to learn from the mentors' life experiences, how to achieve a healthy work-life balance, how to do the financial planning, and guidance regarding future career direction. Thank you so much for your kind listening.
Thank you, Dr. Kaveri. If Dr. Sujay or Dr. Ram want to comment on this survey findings, or any of the mentees want to comment on the survey findings, we can take a few minutes now.
Let's hear from the mentees first.
All right.
Then we'll.
So, Amrita, you're good to go. Does the survey finding kind of align with what you feel, or is there something completely different, or you want to add something?
Nothing to add. It was really interesting, and I think it absolutely reflects what I've been hearing from peers and juniors as well. Definitely, the top concern for them is a more empathetic training environment, especially considering that many people who filled this survey were surgical residents, and the most miserable people I talked to are surgical residents. That seems to be very reflective of the reality. One more interesting thing was also how a lot of people brought up that they need more help with financial aspects of it, which I think is very true. And also about lateral career opportunities, because I was also considering community medicine, but for the same reasons, I then decided to do an academic OG post abroad, for the very same reasons outlined. So for people who can't do that, it'll be good to know lateral career opportunities. I thought the survey was pretty reflective. Amazing job.
Thank you, Amrita. We'll get back to you again. Dania, would you like to go next?
The survey was very well put out. It covered a lot of aspects about what doctors in training face, especially for people who are still in the training process. We are still uncertain about what our future path will be. We might have a general idea, but we don't have a clear-cut plan on how to go about it. So I feel that that would be useful.
Thank you. Karthik, would you like to go next?
The survey actually covered most of the questions what I had. Like even after doing like an MCH course, then what are the career options you have, and where would you be well suited for, and whether you want to do a fellowship next or jump into practice. And what we experience in residency is very much different from what happens in the private practice or corporate sector. So I would like to know from like the seniors how it was and what would be better, and like, we'll have some idea of what each one is, so we would be able to make a good decision, better decision of what we can choose and what to expect in like where we would be going. That's it.
Okay, we'll come back to you again. Pulkit, you're up next.
Yes, ma'am. The survey actually raised all the questions we had in our mind. Mostly, what question I have it's coming out from the umbrella of an institute to a practice. The anxiety and fear kicks in there. So that is the most important question my colleagues might be having.
The transition from institutional training to open practice.
Yes, ma'am.
Right. So we'll get to that. Siddharth, would you like to go next?
Yes, ma'am, sure, ma'am. The survey didn't really talk about MBBS students, I guess. They're mostly of the residents and all. So our questions will be completely different. Our body is INI, or probably which branch to take. Should we even choose surgical branch or a medical branch? So it's completely, different for us. And we have a very vague idea of how the outside world is, or what should we prefer at this particular point. And should we stay in India? Should we go abroad? And does the brand of a particular institute matter, or hands-on experience matters more if at all we take surgical branches? So that is what we are at, ma'am. And we also want, like, if I ask my friends, the major question is, when we choose a branch, should we consider the competition that people speak of? Is competition actually real, or your skills matter at the end of the day? Should you be worried before choosing a branch that it is too overcrowded, that you should not choose that branch and choose something which is niche? So, these are the things that at an MBBS level we know, or we can probably want to know as something. That's it.
So actually, we did discuss this, Siddharth, and hopefully you can, join in with Dr. Kaveri, and maybe we can do a separate survey which is meant just for those who are either in MBBS or just finished, or waiting, preparing for NEET, or waiting for the results to come and things like that. So we definitely will do. I'm sure Dr. Kaveri will help you to design another survey, and then we could probably have a follow-up discussion absolutely aimed only at undergraduates.
Yes, ma'am.
Thank you for your inputs. Last but not the least, Snigdha.
Hello, ma'am. So, yes, I would like to say I think the survey was very well conducted and it was very comprehensive. I think it covers majority of the things that is running through any of our heads. Considering that once we finish our training, these are the biggest challenges that we face. That what does the future hold? Where do we set out from here? And how to actually navigate the world beyond residency? And also, I mean, how to acquire those skills, especially in terms of the staying in the private practice or the financial management, or actually what path to take itself. So I think these questions were very pertinent that really bother or could affect any resident or any mentee at this point. And I think what anybody looks for is like some perspective, some guidance, or something that we can learn from the experiences of people who have so much more than us. So I think that is where it really comes in and is very important.
Thank you, Snigdha. Shaurya, we haven't heard from you.
The survey was conducted very well. Questions were very pertinent. So landscape is very complex. All needs of mentees at various stages are different, and the kind of mentorship people want at various stages in life, wherever they are in their career pathway, is different. But pertaining to residency, it was a well conducted survey and it covered most of the things that at least I wanted covered. Yes.
Yeah. So we'll get to the details of each of these and how how mentors can actually help you. So over to you, Dr. Sujay, because you apparently helped plan the survey.
Thank you. Thank you, Vidya. Basically, I want to divide the responses by the mentees into three groups. One is the career and the career-related planning, training, etc. Second is the financial management, and third is the family issues. Now, the family issues as you become more and more senior, the family kicks in more and more, in a more, I would say, prominent way. But while you are practicing, while you are actually training, while you are trying to learn the skills, and you're going through a tough residency program, the family actually takes a back seat because you are almost like a bonded laborer in the sort of the surgical workforce that you are trying to learn as well as work at the same time, and it becomes very tough. So I understand that the mentees at that level who have already chosen a thing like a surgical pathway, the training is important. The quality of training is also important. And what skills you acquire matter a lot for your future career. So, for example, a small thing would be like if you are in a surgical specialty, what minimally invasive skills you're picking up, whether you're getting that much structured training in that particular field will also have a bearing to what kind of a job market that you can cater to subsequently. And as a mentor in an academic institution, I always feel that while we are training, we would be able to inspire a few people to take up the the uh, the aspect of teaching and mentorship in an academic institution. It may not be the same institute that you are training for, but maybe elsewhere in the country, because that perpetuity and the ethos has to be maintained. Otherwise, the professionalism, the way we work will not be sustainable. So I understand that the financial pressures is such that people will take up, and the positions are not that many that academic institutions can always cater to the bright guys who are coming out. But there has to be a few people who have that, thing in the mind that yes, we have to carry on the cradle, we have to pass on the skills, we have to teach and the next generation so that the skills can, continue to prosper. So that's the kind of a thinking that I have had.
So, Dr. Sujay, you brought out a very important thing that mentorship is often perceived as a one-way thing, that, oh, mentor is giving something to mentee. But that's really not true. It's a two-way street, and mentors also gain a lot from mentee. And sometimes, like you say, we have vested interest in actually mentoring, because what we receive from our mentors, we are very keen that it should pass on and it should live on into the next generation. So, Ram, would you like to kind of sort of differentiate a teacher from a mentor at this point? Because many things that Dr. Sujay mentioned are probably, I mean, the border is hazy. A teacher could be a mentor, but a mentor doesn't necessarily have to, I mean, vice versa. A teacher doesn't always have to be a mentor. So, how would you say that you could be a mentor when you're not exactly, you may not be the actual teacher for that person?
Yeah, Vidya, before that, if I can just comment on the survey, I think it was a very well-structured survey, and it actually opened my eyes to the minds of the younger generation, right? So, I entered the portals of MBBS in JIPMA more than 5 decades ago, 1972 to be exact. And at that time, it was just truly a chance that I became a doctor, because I was one of 5 children in the family. I was probably the first in my immediate family to become a doctor. We had, of course, uncles or aunts or granduncles who were doctors. So we didn't really have somebody as a role model in the immediate family. So the other professions had been taken, and I just became a doctor by chance because I was the youngest of 5. And the elders in the family decided that I should become a doctor. So that's how I became a doctor. But then I think the current generation has put a lot of thought, right? In their younger days, what they want to do, and they've possibly plan their life far ahead of what I would have thought of when I was their age. So I think there's a lot of difference, what we call the generation gap, with the way the youngsters think about a profession or about their life in general, as compared to what the older people in maybe today's attendees might look at it. So it was, some of us entered medicine because we thought it was a noble profession, but I think now there's always a kind of a calculation that's going on in the minds of the younger generation. If I do this, am I going to be really professionally sound? The financial the angle never entered my mind when I was entering medicine. So I'm saying that as the years go by, I think the focus that the younger generation has on what they want to become, I think, has become very clear, and I think that's what uh, was very evident from the survey. Now, coming to what Vidya was asking, uh, about being a teacher and a mentor, I think, you're right, Vidya. The boundaries kind of hazy, because those of us who are in the teaching profession, we stick on to a teaching profession because we are all teachers. But it's not true that every teacher can be a good mentor. So you have to have something additional, beyond being a teacher, beyond being a knowledgeable person who can pass on that knowledge and skills to your postgraduates. That's what is the definition of a teacher in my mind. But I think a mentor would probably be able to, over the course of time, identify the strengths and, more importantly, the weaknesses of a student. Right. And I think if the strengths outweigh the weaknesses, well and good. But I think a mentor should be able to identify where the the younger mentee is probably going to go wrong. And if you can kind of focus their path to the right direction at that time, I think that would make a big difference between being a teacher and a mentor.
Thank you, Ram. We'll come back to you. So, there are more and more women entering the medical profession, and currently, apparently, the number of women postgraduates in surgical specialties outnumber men. So, whether we like it or not, the surgical career is harder on women than men because of pregnancy, childbirth, menopause thing. So, Kaveri, do you think there is a specific role for women mentors? Though normally we are, gender agnostic, teacher can be male, female, anything. But do you think there is a special need for women mentors to step up to help the younger generation of women doctors and surgeons?
Personally, I mean, that's an interesting question. I mean, the answer to that would be on the contrary. I feel more male mentors should come up to help women achieve what they are planning to achieve. Yes, work-life balance and all traditionally has been the responsibility mainly of women, and I think the scenario is changing. So I would like to keep this gender neutral and give the guidance more on the issues at hand. I would not agree that the life cycle of women makes us more, receptive to trauma during training or future life or anything. On the other hand, I feel we are stronger in our emotional EQ, and we are able to handle problems, complex situations, sometimes much better. So, yeah, I think I would keep that out of the equation.
Okay, my point was that the just like we say, they want to all the mentees, whatever people who took the survey mentioned that they will like to gain from the lived experience of the mentors. So it is in that context that I said that in a lived experience of uh, a woman mentor may have some bearing on at least part of what a younger surgeon or younger doctor is looking at. But I mean, your point is well taken.
No, I'd like to comment here, Vidya. I think your question is very valid. And one of the reason I'm pushing it on the male mentors is one of the reasons, both Dr. Sujoy and I have been done reasonably well in our careers is because we stood by each other throughout our journeys. And, so it was never that, you're a woman and you need to take care of this and that, or you're a man. So I think if men understand this more for women, it'll be easier on the woman. So it's more for the man to understand that, and many women have been lucky to find such partners. But yes, I think there's a point there, and it needs to be addressed in some way. But I think a cooperative life partner makes all the difference.
Yeah.
So can I come in a bit, Vidya?
Absolutely.
Yeah. So this is actually has been a raging controversy in the GI surgical forum. And in fact, 3 years ago, we went to the extent of having a forum for women GI surgeons, uh, not necessarily the established ones only, all the at different levels of career. And we organized a meeting in AIMS at the behest of a few of our academic associations. And Dr. Puneet was also part of it. And the the discussion was on the same lines which Dr. Kaveri pointed out, that you need to, once you have made the decision to have a family and also a demanding career, your actually the team, your family team, the two people are the core people who will actually take on the stress, know how to handle it, know how to support each other, and go on with the whole uh, the the thing about gaining the knowledge, acquiring skills, running a family, and running a household. All things, it has to be a teamwork in that sense.
Thank you, Dr. Sujay. Anything already, I think Siddharth at least mentioned specifically that, what the undergrad is looking for is different, which we have not addressed in the survey. So, Siddharth, we'll go to you first. What are the three top things which are bothering you at this point in time, and where you think a mentor would be of some use? And what is the kind of mentor that you're looking for? Siddharth, you're there?
Yes, ma'am, I'm there, ma'am.
Yeah.
Can you please repeat the question? There was a network issue with my.
Yeah. No, I was saying that because the survey didn't actually address issues of undergraduates, we are asking you to go first. And I want you to tell me top three things that are worrying you most at this point in your life, and what do you think a mentor can do to help you? And what is the kind of mentor that you're actually looking for?
Ma'am, first thing, if I would like to answer the last question first. What is the kind of mentor that you're actually looking for? Uh, I mean, someone. If I like, probably I've seen a person who described his mentor as God to him, and someone like मतलब अगर उन्होंने बोला तो कर दिया बस, and वो अगर कुछ बोल रहे तो हमारे लिए बोल रहे, and बस कर देना type. So that's what a person has told to me, and it would be wonderful to have. Parent figure in a mentor types, and it's nice. I mean, I don't know, it must be very childish when I say this, because what we hear of saying that, like, normally what we hear in the departments, I'm not pointing out this to anyone, but saying that few mentors are toxic, or it's very important to get a right mentor or something like that. So that is what I'll probably look for in a mentor. And the most important thing in undergraduate level that we would want to know is, we don't have exposure, ma'am. We don't have any realistic exposure in any particular department. First, the only departments we have exposure is medical departments, that to medicine, a little bit of pediatrics, OBGYN. Surgery, the only thing that we do is theory. So we don't really have any exposure in what exactly happens in the OT or something. So it's all that interest ki hum ye karenge. So we don't exactly know what are we going to do in the future. So that is very blurred when we take up a lane, and then we get to know that we are not suited up for it, and then going through mental health issues or whatever is not okay. Instead, if we have a little हमें आइडिया होना चाहिए कि हमें क्या लेना है, मेडिसिन या सर्जरी, by doing proper rotations, a little bit of research, going deep into the field. And for there, I guess mentor can help by talking about their experiences. Was it that they have taken because उनको भी ऐसा ही था कि लेना था ले लिया, या what did they think of before taking that? So that's where opinions matter a lot for us, and when we choose a career, that is one thing, ma'am. And otherwise, elsewhere, I'm not able to think of anything, ma'am. It's most of the times it's usually like what we hear from people is that one more thing that people tell when we are choosing a career is competition, which I also mentioned in the beginning. Ki, for suppose I like orthopedics, ma'am, now. And the other field that I like is in medical. I like oncology. So the reason people ask me to choose oncology because they think that there are lesser oncologists, and हर हर गली में एक ऑर्थोपेडिशियन है. तो इस बात से फर्क नहीं पड़ता कि मेरे को ऑर्थोपेडिक्स पसंद है, बट लोग ये सोचने के लिए बोलते हैं कि इतने ऑर्थोपेडिक्स है, तेरे पास कौन आएगा. एंड moreover, people say that as in how, and सर्जरी में ये भी बोलते हैं कि you have to grow older to for a patient base to increase. So so you rather start thinking कि 13 years मैंने मेहनत, मतलब after this you do your MD or MS, and later you do your DM or MCH, and then also you are sitting in an OPD or something like that. So it becomes very difficult to digest that you've worked when you worked so hard and all that. So that is one thing which we really want to know, that competition, does it really matter? And we don't even know what we are interested in so much. So how do we exactly choose our field? Is everyone, even the seniors who have just given INI, they also don't know. One of my seniors is really confused. Usko OBG kaha karna hai? He's a male senior, ma'am. He does not understand कि male OBGYNs are very less, so he doesn't really know किससे बात करूं, पहली बात कहाँ करूं, एम्स में करूं, पीजीआई में करूं, या महाराष्ट्र के कॉलेजेस में करूं, एंड कहाँ ज्यादा एक्सपोजर मिलेगा और कहाँ कम क्रिटिसिज्म होगा. ये सबके आंसर सिर्फ मेंटर्स दे सकते हैं, एंड दिस इज लैकिंग इन MBBS for sure.
Vidya, can I just say something?
Yeah.
So, yeah, Siddharth, I think I can resonate with your, thoughts. And I think all MBBS students at some point go through this decision-making process. And it doesn't come easy to anyone. And there are, different points of view of your peers, your seniors. Broadly, what I, this is not a mentorship session going on, but I would like to, Dr. Ramkumar has raised, and I was just going to ask him also his opinion. I feel personally, if it doesn't come, if it is difficult, then that's a different issue. What you like, how many doctors in that street, and what is going to happen 5 years or 10 years later, choose a field that is less competitive. If you don't like that field, if you don't enjoy that field, nothing you do will make you happy 2 years, 5 years, 10 years down the line. So I think you should just cut off the noise focus within yourself and see what you like, what is it that you resonate with, and then just pursue that. uh, I think we need to, at one thing that we were blessed in our generation, our time, that there was noise, but there was less noise, and it was easier for us to focus. Perhaps your generation has more information, and it's difficult to take those decisions now. Dr. Ramkumar, your thoughts on this, please.
Yeah. I thought I'll address some of the concerns that Siddharth had. So once again, Siddharth, I talk about the crossroads that I met in my professional career. And again, it goes way back. So when I was an intern, okay, my interests would change every day. What am I going to become? Like, am I going to become a pediatrician or a pathologist or a surgeon or an anesthesiologist? So I told myself that I'm going to enter every posting that I am given during internship and imagine that's going to be my career for the future. Right. So there are some disciplines, I won't mention them. Okay. I have had interns in the college that I work where it's just taken as a holiday. Just say, 1 week holiday, you don't need to come, just sign the register and go. If that is the attitude of a mentor or a teacher, nobody's ever going to take that subject. Okay, so I think one thing that I did was every posting that I had, whether it was 1 week, 2 weeks, or 7 weeks in the major disciplines, I took it as if I was going to follow that as my career. And sooner or later, I realized this is not for me. Because I think then you have to look at your skill sets. Okay, if you're good with your hands, very generally saying you can become a good surgeon. If you're good at retaining facts and bringing it up in a fraction of a time, you become good as a physician. And I always talk about my discipline, anesthesia, where you've got to be average in both, right? You've got to be good with hand skills and maybe good with recall, and then you can become a good anesthesiologist. And there are a lot more. Of course, you have to. Any doctor has to have empathy, and compassion. You will never, if you don't have that empathy and compassion, better take some discipline where you don't meet any patient at all, like maybe like anatomy, physiology, pathology, or something like that, so that you don't have to really interact with anybody. So I think one, you have to identify your own skill sets first. And two, I would say that you need to go into your internship with an open mind. Don't make up your mind now, Siddharth. I hope you're still there. I don't see you on the screen, but this is not the time for you to make up what you want to do, whether it's oncology or surgical oncology, medical oncology, radiology. There's so many disciplines in oncology itself. So don't make any decision right now. You can have a broad decision, and I think if you have doctors in your family who are there to advise you, that's definitely a plus point. I also would say that there are some among us, among the students who take up medicine because they have to take over their dad's or mom's practice. Mom and dad have invested a lot of money in the hospital that they have built up, and then therefore they have to take up whatever mom and dad wants them to do. So these are some of the things that come up. So in my time, there was no real career counseling. 1978, this is what I applied. Since there was nobody advising me what to do, I just took every discipline as something that I'm going to pursue. And then eventually, I found that I was best suited for anesthesia, and that's what I know that's what I did. And there's no looking back. I'm very happy I became an anesthesiologist. But having after that coming to Manipal, where I now have worked for more than 3 decades, we had a career counseling program for interns. You know, so when you reach internship, every head of the department, starting from anatomy all the way down to the final year subjects, every head of the department used to come and address a group of interns about what is good and bad about their specialty. They gave them both sides of the coin, and I think that's a good thing to do. And I'm sure in AIMS, New Delhi, you must be already definitely having that.
Yeah.
So can you just say whether you have it or not?
Yes, I mean, sir,
Yeah.
the senior junior relationship in AIMS is, I think, one of the best, I guess. And even 1980 के seniors हमें बोलते हैं नाम से बुलाओ. So that chill it is. So
And
we are
I'm
privileged in that way that there is mentorship anywhere, any day you can contact them and they'll respond. But it's like
yeah.
there is
What
not
I
a
meant
specific
specifically
program
was
as such.
what I meant specifically was, see, the people under whom you train, okay,
Yeah.
they have observed you for your entire career. And I think if a teacher who has mentorship in his or her blood will definitely identify the strengths and weaknesses in an individual. And those are the people you need to identify and go to, right? To tell you what Siddharth will be good as, right? So don't make any, predetermined decisions right now. Find a mentor whom you resonate with, you know, who can identify you well, your strengths and your weaknesses, because we all have strengths and weaknesses. Let's not deny the fact. Okay. So you have to find the right combination to settle into the right profession, because as Kabiri said, you can't become something and then 10 years later wonder why you became that particular, why you took up that particular profession. So use your internship very carefully. I know now half of internship is gone in preparing for PG exams, so that is another thing altogether. So I'll stop here. And you said anything
Ram,
specific that
probably the
Kabiri wanted to ask me? Kabiri, you said you wanted to ask me something, but maybe I've covered that. Yeah, Vidya, sorry.
No, I was saying perhaps at the end of the internship, if you're still confused, it may be worthwhile taking a year to just work in what you think you're interested in, then, confirm or this thing, rule out that.
People are
Anirudh,
more worried
No,
about.
no, as a joke, Vidya, if at the end of internship you're still confused what you want to do, you shouldn't have become a doctor at all.
no, not only that, even this cycle of what is hot now and later,
Yeah.
even in places like people who wanted to go to United States took up a specialty because they thought that's what, or UK. But by the time they finished everything, the cycle had turned. Some other specialty was the most lucrative or most needed, or something else fell out of favor because there was too much litigation, or the insurance was more. So I think what Dr. Kaveri says, though it sounds idealistic, that's the only thing I also believe, that better you take up something that you really like, not because it's going to give you a lot of money after 15 years or some fame after 5 years or whatever. So Anirudh, you have your hand up. Anirudh is logged in all the way from Antarctica. So hi, Anirudh.
Hi, am I audible?
Yes.
Yes. Hi. This is a very exciting topic to join, and this is something which is very close to my heart. And just a little bit about myself. I'm a 29-year-old surgeon from Bombay who has basically cleared exams up until cleared all exams up until now in the first time. And I'm a second generation surgeon. And both my parents, who are surgeons, are also on this very call as well. And what I want to actually just talk about is, for a little moment here, is the fact that I am the only child in their friend group who has taken up medicine. And which is something I genuinely want to say, the fact that if they have done whatever they have through their life to inspire me to join medicine, despite how negatively medicine is branded as as a profession in this day and age, with with relative decrease in wages, increasing education, stress, uh, question of ethics. And they inspired me to take up medicine in manners that, without verbally telling me to or asking me to, or I have no practice to get back to, or to take care of after, whenever in this very um, long career in medicine, which is a marathon. So I mean, I'm very grateful for that, but I really want to actually come to a few points that I wanted to make. Number one, the ambition, if like it is a humble request to all the possible mentors who are on this call, who I have immense respect for. Um, because it's so heartening to see your all your ideas, and I genuinely wish I mean, it's so nice to see all of you so positive about the feedback that an undergraduate resident and a fresh postgraduate resident have about what mentorship means in this day and age. But perhaps, like, if the emphasis on ambition as a virtue through the field of medicine or any other career opportunity, I think that we look at ambition as the number one virtue, and it is never said, it is always implied in actions, in words. And I mean, you don't ask them, you tell them कि हाँ कितने साल हो गए कि तुमने पीजी खत्म किया, अब इसके बाद क्या, तुम्हारा तो surgery is a long career ahead. But you don't ask them what makes you happy. Like, if someone asks me why I took up medicine, it's because I love patient I love being around patients. If the only reason that I got through surgical residency was the fact that I could get up in the morning, take morning rounds, and meet my patients, say hi, like hear them, and just try and make that day a little better. And after that, it was all downhill. But that one thing, the fact that ki morning rounds may I get to talk to them, make a couple of jokes with them, um, and that used to make my day to be like, okay, now I can get through the rest of the day, no matter what. And I just feel like a lot of us, like you, sometimes like it's great that Dr. I mean, future Dr. Siddharth, who has joined us, that he is in AIMS Delhi. But I would like to say that there are people who are not in the best institutes, or they consider themselves like they are not in the best institutes, and they feel like they have if I'm breaking up, please let me know. I will repeat because the connection may be slightly
You're all good.
No,
patchy.
you're okay. It's okay.
Um, that that sometimes you just feel like you haven't reached the right place, or you feel like you've done something wrong or not studied hard enough. And I would want to say that even if you go to a place which is not regarded as a good place to train, you learn something. And I don't think, and if any mentor does this, actually I remember a lot of people that I saw would tell me this repeatedly. Especially I'd like to mention Dr. Anand Bharatan, who is a GI and transplant surgeon, I think based in Coimbatore presently, about learning what not to do from from surgeons or doctors around you who are not the best examples of ethical, appropriate medicine in terms of either hierarchy, patient interaction, or anything, but you learn what not to do. And I mean, I just feel like uh, there were a couple of other things that I wanted to bring up about. Someone in the chat mentioned about having that how they have horizontal relationships rather than hierarchy. It is I mean, it is really heartening to see that. And to future Dr. Siddharth, I would like to say that it like don't worry about like, and anyone else who would be a future Dr. Siddharth as well, who's on this call or seeing this video later, that I don't know if it makes like I spent a lot of time, called about 20, 30, 40 people maybe, deciding which specialty I want to do, which hospital I want to go for, and did like a multivariate analysis of it. And now looking back, I'm really not sure if it would have made sense, like if I would have taken up general surgery, or if I would have taken up orthopedics, or if I would have taken up medicine, or if I would have, because I think the main question is, are you a people's person? Do you like spending time with people, or do you like spending time with not interacting with people? And it's completely normal if you don't like doing that too. I don't think like you don't need to like that's fine. But I mean, if you have that clear in your mind that you are a people's person and you want to spend time, you like that, then you will realize that you will anything in the clinical medicine, whether it's PAC OPDs and anesthesia, or if it's surgical residency, when you're like explaining consent to the patient through a multitude of different ways, and instead of speaking to them in medical jargon, try and ask them what they are doing. ठीक है, आप मैकेनिक हो, तो अगर देखो मैकेनिक में अगर आप गाड़ी खोलोगे, अंदर जाके आप बॉनेट के अंदर देखोगे बॉनेट में क्या दिक्कत है, फिर ही पता चलेगा. तो इसलिए मैं डॉक्टर सर्जन होके भगवान नहीं हूँ. इट डिपेंड्स ऑन व्हाट हैपेंस इनसाइड. एंड आई मीन, I'm saying if you enjoy that, anything in the clinical like purview, any clinical specialty, you will love and enjoy. I don't think it's as important as we are made it out, like people make it out to be. You can take it as it comes and take it one step at a time. And just one other thing, I'm really sorry to take up so much
Interrupt
time.
you. Yeah, sorry to interrupt you. So I think you are just making the point that you enjoy dealing with patients. That's what gives
Yes,
you the, the kick, the energy to start your day. And I'll
indeed, indeed.
briefly, and if Dr. Sujoy is here, I would like to ask him what, if you don't mind, made him take the surgical specialty and then do the MCH in GI surgery, though it was a few decades earlier, but something in decision making may be helpful, and then we might come back to you. Is that okay?
So, yeah,
Absolutely,
thanks.
absolutely.
Yeah, okay. I'm sorry I'm interrupting you, Anirudh, but
Apologies for
yeah,
my
it's
verbosity.
no, not at all. So the thing is that I don't know why, but when I entered the corridors, the hallowed corridors of AIMS here, somehow something in me and some of the personalities I met in the course of my undergraduation, they took me towards surgery. Some of them I would like to mention is like Dr. Nandi, then Professor I.K. Dhawan. These are the people who actually inspired me at that point of time. And then I thought it was, I really wanted to do something good for the patient, maybe make him, I thought surgery was magical. So that is the kind of a utopian kind of a ideal which drove me to take up the field of surgery. And then, of course, then one thing led to another. Then I chose GI surgery and other things. But this is how I decided. So I thought probably I had it in me to be a surgery chap.
So, Amrita, with no disrespect to your, alma mater, there's a general hype, right, about JIPMA, CMC Vellore, All India Institute, PGI Chandigarh, all those things, right? But you have done well for yourself. And how did you seem to have somehow found mentors, and then you have also found your career path. So would you like to take us through your story about your and having two parents as doctors, all that pressure, everything? So maybe other mentees can get some insight about your journey.
Thank you so much. I'll try to be as brief as possible, but I really enjoyed the discussion so far. And I'm no offense taken. uh, yes, when I joined Velamal, I was very concerned at the time. Even though I joined in government quota, it was still considered a non-government hospital, and that is, a death sentence here. So it was my concern initially that will I lose out, uh, uh, on good education or good main thing, hands on cutting chance, hands on. This is the most famous buzzword that everybody uses to scare you. But like you said, I was very lucky and I found incredible mentors in Velamal itself, and now I don't think I would be where I am today if I didn't go to Velamal. I'm extremely happy and proud to be that alma mater, which is not what I thought I would say. Definitely, it was unique. And I think what I noticed in this discussion and what I can also agree with is that if you follow your passion, as overrated as it sounds, it will lead you to good places because you are passionate. So you will be able to find a way. Like if there's a will, there's a way is a old adage, but it's true. I went to do an ICMR research project. There was my physiology HOD was very encouraging of research, and I went on a whim. I didn't think I could do research. I was just bored, so I went to her to ask her, tell her an idea I had for an ICMR project, and I think that single moment changed my entire life. And now I have a training position and a research post in like a fantastic university at UK. And it all started with just going to my physiology HOD saying, I don't know how to do research, but I would like to try. And that's all I did. And from there, I found out about this career path by chance when researching, is it possible to do clinical and research at the same time on Google, literally. And that's when I found out there's something called academic fellow in the UK. And that is when I thought, okay, I want to really try for this. And my physiology HOD was such a fantastic mentor. To this date, I tell her I would not be anywhere, I think, without you. I would have burnt out long time ago. And the more proud part, and it was brought up that, it's a two-way street mentorship. She trained me. I ended up teaching more than 200 students about research methodology. All of them are really interested in research now. They want to do papers, they want to do research. And the happy thing about that is they're not doing research just because they want to build their CV for US or UK. Some of them are just doing it because they want to do it. And that's what I really wanted to do. And that's what I was able to do there. So it is literally just you follow your heart, and it will be hard because after I finished MBBS, like many people brought up here, you have one expectation and reality is different. Need didn't go well. Even though I got my PLAB, there were no jobs in the UK for me. I had to come back. I had to work as a JR. I was considering critical care for a while, but then I worked in critical care and decided it's not for me. And then I wrote my MRCOG, and then I now doing going to go for training in OG. So it is just about letting yourself have life experiences and letting yourself get disappointed, and that's okay. It's not everything is going to work out on the first try. I know Siddharth was worried about like competition and like um, you know how life will be afterwards, and the reality versus the expectation versus the reality. But genuinely, if you just keep following your heart, it will eventually lead you to the right place, even though it will take your time. Somebody in the comments said that you'll have a aha moment. That's definitely true. In my internship, I did I before my internship, because my mother is an OGian, I was firmly against doing OG because I don't want that on my head. But then after internship, I couldn't imagine doing anything other than OG, except maybe critical care. And so that was one of the driving forces, and now I'm like, my aim is to do like a more academic career in women's health. So that was the journey. At no point did I have a perfect plan and it went according to plan. Even if I had a plan, it didn't go according to plan. But if you are passionate, I think you will find a way and people will help you on the way. So it is genuinely just finding it, like Anirudh said as well. It's like, even if you're in a bad institute, you will find good people, and yeah, you'll find people who you see and who you decide you're never going to be like. So that is also a form of inspiration, even if it's negative. So whatever institute you come from and whatever career you want to do, if you want to do it, then there will be a way. It will be hard, because I don't think any career in medicine is easy. And like everybody brought up, it keeps changing. My mom was saying dermatology was extremely unpopular when she was young. They're like, what are you going to do? You're going to look at skin? That's not a thing. And now dermatology is a top branch and almost impossible to get through NEET PG or any set. So it keeps changing. It keeps growing in popularity and then shrinking. So following your passion seems to be the most sensible, logical route to follow in the long term. So
Yeah, Amrita, I'm glad you kind of reiterated that. And also, it's kind of a journey, and you need to expose yourself and find your passion. It won't
absolutely.
just come one day. You need to attend the rounds. You need to, be there to kind of know what you would want along the journey. Before going to you, Vidya, quick question to both Dr. Shaurya and Dr. Snigdha. One is doing an MCH and one has finished DM in reproductive medicine. Would like to hear from them if at any point in their journey did they feel the need for a mentor, and how would they have wanted the mentor to be, how would they have wanted to reach that mentor, because this discussion is about how can we make ourselves easily available for people who want to hear from other doctors. So Shaurya and then Snigdha, I would like to hear from you, please.
So, actually, need for mentorship, so our lines are very blurred. So, teaching in residency, especially, so we are all very overworked. Residents, consultants, everybody is stretched out. So, mentorship per se, we seek mentorship from various places, like peers, my immediate seniors, or senior to them. So, the kind of problems that I have and the solutions that I'm trying to find from people, they come from various places. The it also matters the kind of mentee that I am. I'm a very crisis driven kind of a person. So I will only seek help when there is a crisis. So that really matters. Ki, for me, my when I'm seeking mentorship is when I'm in a crisis. So the kind of people that I will go to will depend upon the situation that I am in. So it is not like, for me, it is never a one-on-one type of a thing. It will depend upon the kind of situation I am in, and in that moment, who do I need? Do I need my sister, who is also my mentor? Do I need my senior who is also a resident but is senior to me? Or do I need a faculty, a very senior person who can answer my questions? So these crises that I am in, like small or big, the kind of situation I am in will dictate the kind of mentorship that I'm seeking. तो उस हिसाब से I will just seek mentorship. So I can say I need mentorship on a daily basis, but how I'm seeking it will vary. So I think.
So if I could just jut in, Shaurya, you brought up a very important point about matrix mentorship. It's like when we were children, we had this best friend and all. So like that, one mentor is never going to be enough. It was never enough before, and definitely won't be enough now. And you brought up a very important point that one mentor cannot solve or help you with all your problems. So you need to have several people, like like as friends, you might have somebody who you go to gym with, someone else you go to a movie with, or someone else you cry over some relationship issues or whatever. So you perfectly brought out that point that you need to have that ability to get the correct person. So like you mentioned, your near peers are going to be one of your more important mentors. Like for Siddharth, maybe somebody who's finished just taken up a specialty will be in a better position to explain how they went through the process. Thank you for bringing those points up. Over to you, Snigdha.
So yes, ma'am. So I think definitely, I think through the course of your entire training, the need that you would want to be mentored by someone arises in a lot of ways, especially from the day you start to how you go on, how you continue. And everyone, I think, experiences residency and the training differently. Someone can just go about very easily, just be very comfortable, just be going out about the day very nicely, while someone might just be struggling with the smallest things. So I think just identifying that, and I think it just comes in the smallest things, like I mean just the small discussion after rounds, or just after a presentation or something. It does not need to be like a one-on-one didactic thing that happens, that you carve out time for that. Especially it's just in the very small things where it matters, wherein it can really have an impact on someone. So I think that's where it comes in. And I think during the training there are a lot of ways, I mean in terms of how you are trained with the skills. So that is the biggest thing that I think everybody feels, where it matters. Then also wherein somebody can guide you that what opportunities might be available after the training, for further training, for say research. I think research is a very big thing, that so if somebody is interested in but they don't know how or where, whom to approach, how to go about it. So I think these very small things that really matter during the course of the training and the residency journey, wherein it can have an impact on someone, and where I feel that I might have had the need that if I could have someone reach out to me, or something like that. Like I had a very surreal moment during my MBBS. I was in the US at Hopkins for 2 months, and on the very last day of my elective, the professor was a very senior gastroenterologist. He took me to lunch. He invited me to lunch in the cafeteria, and he took me for an hour, and he sat down. He spoke to me. What are my plans? How does USMLE look like? What is the journey? What I might need? So I think here, especially the hierarchical structure that we have, we feel we cannot reach out. So at least if we get that from somebody, that definitely has the way to have an impact on us. So I think these are the things that would mean and matter to mentees.
So you would rather that a mentor reached out to you because you feel that most people in our country have difficulty reaching out to a mentor. Is that what you're trying to say?
Both ways, ma'am. Both ways. There is some definite hesitation also that might be existing, and sometimes you might have tried to reach out, but maybe not got what you would have expected also. So I think it's both ways. But somewhere you might have reached out and had a lot of somebody who might have helped you out or influenced you in a really big manner. So it's both ways, ma'am.
So I was just, randomly listening to some videos about mentorship. So in one interesting story was that there is this lady who has mentored many people, and she responds only after the person has sent a third email to, filter out who is more serious. So perhaps, even as mentees, you cannot give up. You went and asked somebody something they didn't drop everything to solve your problems.
Definitely.
They are also busy. They're like Shaurya mentioned, everybody, especially in a very busy institute, everybody is busy. So I don't think as a mentee, you should hesitate to ask a second time or even a third time. You're going to lose nothing by asking. At the most, the answer can be no. It's like a flipping a coin. So you have a 50% chance the answer will be yes. So no harm in doing it again. So actually, the reason I wanted to come to Karthik straight after, Siddharth was because Karthik made a major decision. Immediately after finishing MBBS, he decided he can go straight on to neurosurgery. So were there any mentors who helped you, like unlike Amrita, you didn't do any trial and error, you just went straight for it. So uh, did you have some guidance or how did it happen? You're muted, Karthik.
During internship, when I went through my surgery and medicine postings, I liked them both actually, but I found I liked surgery better, and I wanted to do more surgeries, and I had that more kind of satisfaction and the feel of surgery. So I tried to see. It was more of a initially it was at least a logical decision to I was thinking what super specialties could be. So I tried to go to attend the super specialties in at JIPMER. Fortunate enough, I had met few of the neurosurgery residents and tried to go to OT during the internship and tried to speak to them. And through that, I had an idea of how this could be. And like based on that, at the end of the internship, I made my decision that I wanted to get into this neurosurgery, and I thought 6 years could be a good choice because neurosurgery might require a longer, training, and it would be more focused, is what I thought. And I tried to speak to a few. I think at least before joining, I didn't speak to any consultants, but I found some good seniors during in the surgery, and few from NIMHANS where like when I spoke to them, I really resonated with them. Where few people like they had joined general surgery at JIPMER and they had gone through for 1 or 2 semesters, and then they had dropped out and took the 6 year course because they felt that like it was they that's what they had to do. And I don't know, I somewhat had that zeal and passion to do neurosurgery, I guess. And then I went through it, and till now I don't regret that decision. So it's good as of now.
So if any of you younger doctors have anything particular to say, you can go now. Otherwise, I'll go back to the Dania. You've been quiet for a long time. You would like to add anything?
Regarding this selection of career also, as mentioned earlier, as sir mentioned earlier, during internship, going to each posting and considering as that would be the course that you want to do for the rest of your life actually helped me a lot. I did since we can select 2 electives in internship, I had selected 2 branches which I thought I might consider doing as a career, one of which was plastic surgery and one was radiation oncology. I attended both the postings along with all the other mandated postings. And after speaking to the residents who were posted in both the branches, I prior to going into the posting, I had an aspect like I want to do plastic surgery. It'll be a good with work-life balance and good results. But after I spoke to the residents, I felt like it was not a good match for me with what I expected and what was the actual ground reality. Similarly for radiation oncology. Then after that, I was still confused basically at the end of internship. And then after weighing all the pros and cons of branches, I made a choice for ophthalmology. Even after that, I still had a doubt whether should I go for an MS or should I go for a DNB in an institute like Arvind or Shankara. But then after speaking to a few more people, I decided to join back as an MS graduate itself, and I do not regret my decision. I feel like we have in if we have also gone from JIPMER to Arvind Hospital for training programs, so they do have a very high caseload. The residents who are at the same level of training as me in Arvind, they have had way more surgical exposure than we have at our stage. but we also have a good balance of both surgical and non-surgical training, both in terms of lectures, in terms of OPD management, and in terms of surgical hands-on exposure. So I feel like this taking internship seriously and speaking to people who are also in the same field as you really did help in deciding what I want to do. My next problem that we have is in the future, what to do further is my doubtful area of free.
So have you identified a mentor who could help you through that?
Yes, ma'am. Actually, now in Avtar also we have so many subspecialties to choose from to specialize in. So there are a few subspecialties that I'm interested in. I have spoken to a few people, but still I am not yet decided what specific field to go into, because there are pros and cons of each. There are one more problem here is that being a first generation doctor, I don't have any backup family members to speak to regarding this establishing a practice, or whether to go into corporate practice directly. And the investment required for an ophthal practice is very high, especially if you're doing it for the first time. So I will need a little more discussion to decide on what to do next.
Right. So you would like a mentor who would
Yes.
help you decide on if you should do a subspecialty or where to do, and also how to go about setting up your practice. Would that
Yes.
would be okay? So actually, a lot of this talk has been happening about institutional people working in institutes and all. But a lot of mentoring can happen even in private practice or in non teaching institutions. So there have been some comments on the chat box about that. We'll probably get to that. Kaveri, you were trying to say something.
Yeah, I was trying to say that, going back to what Snigdha was saying and what you said, I think what you said was absolutely right. But I also, by insisting on what you need from your mentor, but I also resonate with her, as it brings me back to my days when I was a mentee and coming from the same institute with the great teachers, great academics, clinical skill discussion. But somewhere I think we also personally have not been groomed to reach out and ask questions at a younger age, and it comes only later. And also the hierarchical structure that prevents an easy reach to our professors and teachers. I think it's very important that the barrier, the distance, gets smaller, so that the residents, they feel much more easy to reach out to senior consultants and senior doctors. I think that's a very, very valid point in today's teaching institutes. I can speak for myself, which was many, many years ago, and I'm sure it's getting better, but it's still there.
Anjali, you put your hand up. Did you want to say something?
Yes, madam. Good evening. Am I audible, ma'am?
Yes.
Yeah. Wonderful discussion, and I think medicine is such a branch where every day you have different thoughts, and every day you need to learn a lot. That is what I could make. In short, the younger generations and the senior generations like Dr. Ramkumar sir, after listening now, when my elder son is in the third MBBS, when he entered into the medicine, in the first year itself, when he said, I want to come to the operation theater, and he started coming to the theaters, and what next coming to his mind. But one day I said, if you want to assist me, first you should go to the waiting room of the patients. You sit there, you observe what is the complaint of the patient, what they suffer from, and how you need to act. Then nextly I send him to the pharmacist. that you go to the pharmacy shop of the hospital, just see how the pharmacist talks to them, how the medicine are prescribed, how you need to describe the medicine which has been prescribed, and what are their common questions. Then you come to the reception counter, and then gradually you need to learn how you act as a total human being when you approach to any patient suffering from pain. And then you can directly come to the theater and learn all of the things. But over the time, now he is in third MBBS, he has been grown to such an extent that he really understands the suffering of the patient, how he has been reaching here, what is his financial capacity. So in short, uh, at every stage, even I was, when I was a resident at the first year MS, how to apply the scrotal support, the ward boy and the sister, the senior sister, was a mentor for me that time, because I don't know. I could not ask to my PG teacher, sir, I don't know. So after the round has been finished, the senior most teacher or a senior most sister of the ward, she was my mentor for that time. So in short, the mentorship is such a phenomenon. Your mindset makes it a thing where what to learn from whom. Now, the next challenge is when you acquire a degree, MS, MCH, or whatever, and when you have been offered to touch to the patient, and when you can offer what is the best modality of treatment to that patient, then comes the real question of a doctor as a challenge. And here starts the role of mentorship, that have I done anything wrong? I could have offered something else. If I am not okay with the laparoscopic surgery for this person, should I refer this patient to somebody else who is more skillful than me? So, such thought process has to be brought in. And these are my short messages which I want to give you to the younger generations, and excellent viewpoints. I should appreciate the younger generation has become more talkative, more expressive. As Dr. Kaberi has already said, that we were not having so much explosion of expressing ourselves. We could have been more better doctors if we would have been born in this generation. That is what I could admire. And thank you for the wonderful session you are conducting. The same session I have conducted in my parent medical college, from a UG student to the dean of the college. It went for 3.5 hours in the medical college on Teachers' Day. It was a gift from my side to the college, and such things make you a perfect human being. That is what my say is. Thank you so much.
Thank you. Thank you so much, Anjali. We have Dr. Raman Kataria, who founded the Jan Swasthi Sahyog. Would you like to say what you have typed on the chat box, Dr. Kataria?
Yeah, thank you, Dr. Vidya. And I just want to the same thing, that I think if you follow your heart and you remember why you came into this profession, that is something that you need to remind yourself repeatedly. And that is what is likely to take you to your destination, or lead you to your destiny. So I think that is what several people have said already. So thank you.
Thank you, Dr. Raman. If any of you need a mentor on how to, work in a resource-constrained area, or in, for want of a better word, a remote place, please feel free. Dr. Raman Katia is always willing to mentor you on that. Puneet, you have a hand up. You want to say something?
Yeah, since Raman was there, I just wanted to share that I think he's one of the reasons why Anirudh took up surgery, because straight from AFMC he went there to JSS to see. And I urge a lot of the undergraduate students now in Amrita here, because they all come from good social strata, to actually go to JSS or to Gudalur, or that other place in Tamil Nadu. I'm forgetting, Setlingi, or Anand, because I think if they see both spectrums, they know what kind of mentorship they want. And I think a lot of answers, what people are looking for, they'll get there. Couple of points I wanted to make. Kaberi just stressed something which I feel I never realized, but now I feel very strongly about is, when we started that women in GI surgery program, I suggested to a lot of the girls that, have one of the ladies as mentors, but she just made that point about having male mentors. And through this program, I've been thinking it's very, very crucial to have actually male mentors for the exact reason that somebody said that, the mentors also learn. I think it's a best sensitizing thing for the guys. It's a fantastic role model when that succeeds. And I realized one of the girls younger GI surgeons who told me she was having some problems, and I suggested, I may not be the best to talk to one of the senior ladies, and she said all I'm getting is bitterness from their side. And I realized a lot of the problems those people had may not be there now, so we don't need to reinvent the wheel there. And I think I was able to help her out in that situation very well. So that's a very important point you made, Kaveri, both ways. I think it helps both people. And I think we throughout some of the youngsters are confusing the training with mentorship. So I think Dr. Ram made some fantastic points, and whoever's seeing it in video, please go back and listen to them again. So I think as far as the need for mentorship is concerned, because that's where the survey looked at it, I think it could be different for different people. There's some people in Chhattisgarh itself, in South Chhattisgarh, one of our medical students who set up a surgical practice. I told him to do MCH. He said, not, he was a very mature guy, and I think he didn't need really any of the training and all that, or the extra, the advanced mentorship. He knew what he was going for, what he was trying to achieve there, and I think he's achieved that in a very short while. There's some people who need it, who need, like Dr. Rams was, saying that, or Ravi was saying that it's not that you need to be taught or told or whatever. But some people do better if they have a choice which is told to them, and then they realize that, oh gosh, I never really thought of this. So I think everybody is different. So I think we need all kinds. And some, surprisingly, particularly in surgery, need it much later in life. So I've had a whole host of people who approached me at age 40 plus, and especially from Gujarat and even from Tanzania. People have come, left their practice for 6 months and come and said, we want to see what's different. How is it? I went to Cambridge at after the age of 40 to see. It's not that I learned any new techniques, but I think I learned how to communicate with the patient really, because taking those consents. So I think we shouldn't feel ashamed if you don't know. As far as if you have your passion clear, we were a little that if you don't know till your internship, then you don't know later. I'm not sure about that, because I think some people don't. You realize what you've taken may not be what you really thought it was. And there's absolutely no harm in shifting gears, in looking. But my suggestion to the youngsters is trust me on one thing, that whatever you take, I think if you like it, you're going to end up enjoying it irrespective. I actually wanted to do geography and not medicine. And I think I wouldn't want to live any other life but medicine again. My principal, the DPS biology teacher told me I'll never become a surgeon. Forget about doctor. Forget about surgeon. You'll never become a doctor. And life had different. So I think if you enjoy what you do, that's more important. I think you're going to do well irrespective. Don't chase money. Don't look too much in the future. As Dr. Ram said, I think many of us didn't have burnout, and this thing is because we weren't so worried about the future. You can't plan out every last bit. And things are going to change. There's a lovely series of movies called Smoking, No Smoking in French. Please see that, where they showed every level things can change. Things can go a different route. And you can still like it, and if your passion is not there, you might find an arranged marriage. Maybe sometimes you might have the avishkar or the anubhav of a different kind of grey pravesh, where the marriages are different. So that's my two bit for that.
Thanks. Colonel Harikrishnan, you have your hand up for a while. You also mentioned about the rotatory internship.
Yes. Yeah. But I'm going to start with something Dr. Dhar said. I'll go one step further, Dr. Dhar, that if you end up getting pushed even into a particular specialty, it is quite possible that you will find that beginning to interest you, and over a period of time, if you work hard and get more and more interested, you'll become better and better at it, and that will be your final call in your life. This happens especially in the army, especially in the AFMC, when you have to end up sitting for an exam to decide which specialty you will be allotted. And then somebody wants surgery, but is told, sorry, you haven't got the marks on the top of the 2 vacancies for surgery. You can apply for dermatology or you can apply for radiology. Now, there was a very dear friend of mine who was so depressed. Then we all sat with him and I said, look, take some specialty rather than no specialty. And he went into radiology and he became one of the finest chaps in the Indian Army's history to become a super specialist in radiology, and he worked in DRDO for donkey's years and reached the highest possible rank. So it is possible, and this is a good advice for all youngsters to remember, you don't have to necessarily have that aha moment. If it is there, it is good, but you can develop that aha moment. So please don't be worried about what's going to happen. Take interest in whatever you even get pushed into, and it will work out well. A couple of other points, please, if you don't mind. In 1972-73, we had a student counselor in Maulana Azad Medical College, where I was a medical student then. We had a wonderful surgeon called Dr. Nigam who suddenly went blind. The hospital, the college did not want to lose him, so they made him a student counselor. He was one of the finest persons to guide all of us. I spent time with him because I was also confused as a young chap. Should I go in for surgery? Should I go in for medicine? I like both specialties, both main branches. And he helped clear some of my the cobwebs in my mind. And I think that underscores the point I put in the chat box, that teaching, counseling, mentoring, I think there's a bit of a haze there somewhere, and we need to understand what it is. In fact, I would like to add coaching, which is a very famous topic of Atul Gawande. There are some videos of his youngsters should see about coaching in surgery and coaching in other specialties. Having said that, that particular video is not half as great. In fact, it is a little cliched as compared to what he has written in his book. So overall, it is definitely good to follow your heart, but remember that heart alone is not enough. Hard work and commitment to your specialty will take you places where nobody can. And mentoring, as many people have pointed out, will need to be changed, its shape and its physical presence as you go along in the specialty, because somewhere along the line I was told that don't go for laparoscopic surgery, it's a splash in the pan. And whoever said that obviously knows that that was a very, very wrong advice to give to a junior. So that's where I would like to leave my bits. Thank you.
Vani, you've had your hand up for a while.
Yeah, I just want to say, Vidya, that I was very much carried away by Anirudh and Amrita, who started this Follow Your Heart. Once they said Follow Your Heart, our discussion went another way, because before that, the youngsters usually want to know which is successful. We were talking about financial, right? How successful it be, how much money you will earn, because the doctor in the family doesn't earn much, but the engineer earns a lot. But if you have to be a doctor, you have to follow your heart. And I would give credit to Anirudh's and Amrita's parents who were doctors. And like my children, they didn't want to do medicine, they did engineering. So clearly IT earns, and I've heard them all talking. They talk about, I mean, not my kids, but generally I've heard these work from home calls. They're talking in crores and layoffs, and all those things don't happen in medicine, hopefully. We don't talk in crores, we don't talk about layoffs. You have to follow your heart. Your patients are your friends for life. And the greatest thing is when you get old like us, you know your own body. So you know what's happening. You don't have to listen to Google. And there are no good or bad institutes. I studied in JIPMA and I came to KMC. So JIPMA taught me some things, KMC taught me some style. But I attended class like crazy in KMC. And then I went to St. John's. And because I'd attended class without knowing about factor 10 deficiency, I asked my senior resident, what do I do? She's bleeding. The senior resident said, Madam, do active management of labor. So this was, Ram and I were reading about reverse mentorship, and Ram was also talking about mentor as tormentor. So your aim is to be satisfy your patients. Your aim is not fame or money. And the last two things I want to say is, my mentor, when I was a PG, this is all this got activated by the discussion. In post-op ward, when I'm a first year PG, I'm also married. So my mentor was Prabha, my senior resident, who while teaching me about cesarean and post-op rounds, told me how to make rajma that night because my classmates were coming. And later when I got pregnant, she taught me about open, front open bras for breastfeeding. So your mentor, your senior PG or senior resident also becomes your mentor. And there is a definite hierarchy in medicine that I always feel so. And my mentor at work was Dr. Kunta Rao. So all the time you need mentors. And thank you for giving me a chance to speak.
Ravi, you have your hand up. You're probably going to also address something that Zoom user has said. So this question about, just listening to what mentor is not there to tell you what to do is my thought. What are yours?
Yes, actually, I did put a thing there saying that there is a difference between teaching and mentoring and coaching. Colonel Hari Krishnan brought that up. I'm going to avoid the coaching part, but mentoring is very different from teaching. Teaching is where you tell people this is what the textbook says, this is what some reference says, and this is what we believe is to be true. Mentoring is very different, and it needs to be done in such a way that all the facts are presented, the pros and cons of everything is discussed, and the person who's being mentored is empowered to make a decision. It's not about telling them what to do, because that would be very difficult. And as parents, we know we can't tell our kids what to do. I mean, how can mentors tell mentees what to do? It's a very different process. So that definitely, I totally agree with that post. I believe in that very clearly, and I also believe that mentorship should be sought, because unlike that Dakshinamurti stotram that I put out there, you cannot telepathically figure out who wants what. So mentorship should be sought. You should ask. There is absolutely no shame in asking at any time. Puneet mentioned about people who come in at 40 and seek mentorship. Yes, there's nothing wrong. I mean, age is a useless number here. If you don't know something and you think somebody else knows something, you ask them. So it's that part has to go. That so I am older, so I cannot ask questions, or I cannot seek mentorship. I should know everything. No, the world is changing. You are changing. Your needs are changing. So you need to be very open to moving to different people at different stages in your life for different types of mentorship. And I love the idea of a matrix mentorship thing where you have different people to mentor you at different times, even in a given stage of your life. So that is fantastic. And finally, I this is for Colonel Hari Krishnan. So to summarize what he said, to what he and everybody else said, including Anirudhan and Amritavarshini, basically you're going back to karmanyeva adhikaraste ma phaleshu kadachana. So do follow your heart, and everything else will be left. So
Yeah,
thank
thank
you.
you. Though we are very, very much out of time, Kaveri, I want to come back to you on this. Don't we need training to be mentors? Colonel Hari Krishnan has also brought this up. That I mean, most of us, I don't know how the academic scenario in academic institution is today, but where do we go to get trained to be good mentors?
Yeah, I think Vidya, that's a very important question. And like you and I had discussed earlier, and what Dr. Ravi has just mentioned, that mentors I'll come back to your training bit. That there are different parts. There's teaching, there's coaching, there's mentorship, and the thought came from something which we may have experienced when we were the age of mentees, where we wished we could access people who could guide us. I'm a first generation doctor, with just going the way life took us. Unfortunately, it took us a good way, but it may not have also. So that's where the thought came from. And we are quite clear that there are different forms of mentorship, coaching, teaching. We need to kind of divide that. And also, maybe we just need, and this was your suggestion, Vidya, that we need a pool of emails or people who are available. For me, I would just be happy to share my experiences or give guidance as to what I might have done and why I would have done that, which may not, be what the person wants to hear. So, a group of people would be a better, maybe a conglomerate of such doctors. Dr. Puneet's conclusion was fantastic. So, yeah, I think training is important, but first, once we know what exactly they need, mentorship at some point, guidance at some point, that's very clear. But how do they need it? Who is to give it? I think we need synthesis of these thoughts more and then come to the decision as to how that training has to happen. I think there's food for thought. Your question is food for thought for me, Vidya. Anybody else who would like to answer that?
We'll give a quick round to, after Dr. Sujay, we'll quick round to wrap up with the mentee.
I just wanted to just add one thing, and that is when you talk about mentor-mentee relationship, it is at a very I would say very close level. A mentor cannot become a mentor unless the situations are such that the mentee and the mentor are, you know, are in a situation that they meet each other frequently, and there is a element of trust or a professional bond which has already been there. And then the task of a mentee and a mentor who is trying to, train the mentee in the professional way, as well as giving life lessons during that whole thing. Now, this kind of a relationship works only when you are actually close at hand, or you're working in the same team, or you're probably, have in some way been interacting with each other. That's what I feel.
Yeah, actually, though I wasn't planning to say anything, I actually have a contrary view. I think, given this question of hierarchy and also being judged and all, I want to hear from the youngsters. Do you think you would rather have a mentee who's not, under whom you're not working? Somebody outside with whom you can be free and speak whatever, or actually have a different view? Please think about that. Meanwhile, Venkatesh, you have your hand up.
Yes, ma'am. A very interesting session. I have an anecdote to share and a question to the young doctors. The anecdote is this. When I was young, I took a fancy for learning the mridangam. So, as usual, we have to go through our mother. So I asked my mother, I want to learn the mridangam. So she went and told my father that the boy wants to learn mridangam. My father said nothing. And after some time, again, I went and told my mother a couple of days later that I want to learn the mridangam. Then a month passed, and I never made any attempt to approach the subject again. Then my mother went to my father and asked him, "See, he wants to learn the mridangam. Why are you not encouraging him?" So the answer he gave is this: See, if he really wanted to learn the mridangam, he would have found out where it is available, who's going to teach it, and how is he going to learn it, and how much time he is going to spend for it. He has no idea about any of these things, and it is just a fanciful thought which will pass by time. And that stood by me for a very long period of time. And as some of the seniors pointed out, it is also actually very important for us to not to feel shy or put off to approach someone with the necessary skill sets or the necessary information where you can go and seek and learn. And that thought process stuck with me for a very long period of time. And wherever I went, I found it. I emboldened myself to go and ask someone for something, and I always got what I wanted. And that's because the first place I asked for it, and then the second thing is, the moment you ask, it opens up a whole new world where relationships blossom, where people understand each other, and your mentor happens to be there right there in front of you. But it is the responsibility of us to go and ask. So that is the lesson that I learned from the anecdote. Now the question is, sometimes this happens to be this whole exercise of finding a mentor or finding a mentee seems to be a very random event in the universe. I don't think so. That's how it should be. So my question is to the young doctors: do you have conducive systems in your current training program where mentors and mentees are matched with each other in one way or the other in a very easy way, so that every student seems to get one mentor and every mentor seems to get one mentee? Is there a systemic process which is available in your training or in your institution nowadays? That's a question for you all. Thank you.
Who would like to go first?
I would like to go first,
Yeah, okay.
if possible. If there's anyone else, otherwise.
Yeah, go ahead.
Um, um, I just a second. I think there's a bit of hello.
Yeah, we can hear you.
Yeah. One of the things that if I got the question was exactly okay, that what kind of mentors we would like. Is that correct? I'm sorry, right? There was a
Yes, and if there is a system in the place that you're studying, the question was addressed to students, whether in their
yes.
institution, there is a systematic way of matching mentors to mentees.
Yes, sir. Actually, since I have an experience of going to 3 different institutions, KMC Manipal for 20 days in my MBBS, after which I moved to AFMC and then to Mumbai and for my surgical residency. So I would like to say in KMC Manipal is the finest had in terms of mentorship program where undergraduates were allotted to different mentors. And AFMC as well would have that, but it would be done a lot more informally, but it was still great. But and in residency, on the other hand, your mentor is also your thesis guide. So when you're in a problem, the problem was that my thesis guide was also supposed to be my mentor. And the thing is that if I'm having issues in my life, I would be scared to approach him because I would be concerned that he would ask me about my thesis updates instead of being in a position to talk about what is troubling me at this point in time.
Yeah, so we'd like to hear from the others who are in active training now. Who would like to go first? Yes, Abrita.
Yeah, so just to cover both the points at the same time, there was a suggestion of assigning a mentor, which I think is in theory a really good idea. And there was something similar in my college, but the thing is, our mentor never talked to us, and I ended up gravitating towards somebody else anyway. Even in the UK, you get assigned a responsible officer, but people there have told me that they end up gravitating towards a senior consultant or a senior most trainee who gets them more. I think it's a good starting place because if there is nowhere else to go, at least you have somewhere to go. But ultimately, I do think students and trainees gravitate towards people who they feel a kind of kinship or they find a kind of inspiration from them. Like, let's say I get assigned to someone doing more emergency obstetrics, but my passion is fetal medicine, I will end up gravitating more towards the person doing fetal medicine. I think that's just something that naturally happens. And also, I think in Indian colleges there is a staffing issue. Is there a passionate mentor to mentee ratio that is available? Because some people are just assigned, and not all teachers want to be mentors. That is my observation. But it is a good starting place. And I think it's a good idea, but in theory, and it just needs some fixes practically. The other thing that was mentioned was having mentors who are outside the institution. I definitely think that there is value in that. Yes, of course, it would be good if the mentor is in the institution because they are seeing you every day. But unfortunately, not all institutions have teachers who want to be mentors, who know how to be mentors. There might be kids there who after residency they want to go to the US, but if they bring it up, people will just criticize them saying, why do you want to go to the US? Why don't you want, do you not like India? Do you not want to practice in India? So there's no exploration of that mentees wants, which I think is part of the discussion that needs to happen between mentor mentee. In that situation, having a mentor from the outside would be incredibly helpful. I've had mentors from the outside. Apart from my mentor inside college, Tilaka ma'am was a big mentor for me, for teaching me how to teach. Vidya ma'am has been a great mentor. Patta sir has been a great mentor. So because of Marvelous Medicine as well, I've been connected with more mentors. So I think Yes, it would be ideal to have a mentor in your institution or like a senior resident who kind of takes care of you. But there is nothing wrong with also outsourcing that, especially if you're in a smaller institution where mentoring isn't really a thing. It is a thing, I guess, in maybe places like Jipmer or Ames, but certainly in Velamal, it wasn't a thing. I know in a lot of GHS, it's not a thing. So I think this would benefit students like that. Having a mentorship program that's not dependent on what college they're from would be extremely beneficial. So that's what I wanted to say.
Yeah. Any of you younger folks have something to add, or you differ? You have a different opinion? No. If anyone else has anything to say, please put your hand up. Otherwise, we are going to Radhakrishna. And perhaps Radhakrishna can mention about. You can talk about what we hope to achieve through our website.
Can I add something?
Yeah, Yogesh.
The NMC has come out with mentoring as a compulsory thing from 2023. Initially, it said 5, then it has reduced the mentees to 3. Only problem is many of the colleges don't have enough staff, and many of the staffs are not mentors. Like they also need training to be a mentor. Like it is supposedly while mentoring you learn a lot of things, but many of the faculty take it as a extra work. Like a surgeon will take it as a waste of time. There is supposed to be a group mentoring followed by individual mentoring. So how much time you will give, and then when to allot the time to the student. And the students also have a fixed timetable. 9 to 5 is fixed for them. So all the colleges are implementing it by trial and error. Like it was supposed to start in 2023-24. So we have been experimenting with the way how to implement in UG curriculum. PG is going on in the traditional way. That is what I wanted to add.
Thank you so much, Yogesh. Over to you, Radhakrishna.
Vidya, I mean, it's nice that the discussion has gone so long. And the Kaveri and Sujay have done a wonderful job by making a Google sheet and put up a questionnaire, and many things came out of it. And one thing we all have to agree is that most respondents felt that there is a need for mentorship. That's something which we should understand. But the only disappointing thing about the study is that I think a mentor is much more needed during MBBS than MS, MCH, whatever. By the time they come to MS, MCH, they already have a certain path. And most confusion happens during MBBS, especially toward final MBBS internship. I wish Kaveri will come up with another study and more MBBS are included. Now, the other interesting thing which I noticed is one-to-one mentorship is what everyone wants. And I do not know. See, after starting learning general surgery, the social media thing, I mean, the world has become a university. Anybody can meet anybody online. Anybody can meet anybody as anybody can assess anybody online. And actually, Vidya should agree that learning general surgery has created this mentorship in a very big way, which we do not know. But the sad thing about marvelous medicine when we started it for younger generation, we don't get anybody in there. If all the youngsters who attended these sessions, they would have come across so many mentors, so many. And everybody who spoke in this platform gave their email ID, and they've been very, very happy to mentor people. But sadly, the thing which we are worried is why is that youngsters have no liking for such online meetings where very big shots come talk very great things. That's something which we always wanted to know, but we couldn't get any answer for that. Now, as many mentioned, mentorship is just not to do with academics and career. Mentorship is got to do everything. A mentor is a friend, a mentor is a philosopher, a mentor is a pacifier, and he is a person whom you need when you're in trouble. So it's not that easy. Now, I think one should consider, when Sujay says that a mentor is somebody whom you should be working with and so on and so forth. I agree on that, but I think now long distance mentoring is very much possible, and one need to explore that. And here, I mean, it's so easy to talk to someone online or communicate. It's so easy, which isn't there when me and Vidya or Puneet are doing MBBS. I think the options are many. We need to keep our eyes open, and we need to get into such platforms to see that there are people who are willing to mentor. And again, the point Vidya was mentioning that mentors need to be mentored, or rather, they need how to mentor. I think unless until you've been a mentee, you had a mentor, you'll not know what a mentor is. And I think that's a very important. I'm sure Amrita must be mentoring somebody already. So there's somebody who's following you, and that's how it is. No, this has opened up a huge area, Vidya. Now, when Sujay says, when it comes to training, when you should learn, skills, you have to learn surgical etiquette at all. I think we need to have separate sessions for these altogether. Separate sessions, we have faculty discussing how to get the most of your training, how to get the most of your surgical skills. And I think there are some seniors, good batch of seniors advising this. When somebody says, I don't know whether to go to the government service or private sector, and whether I have to go to state government, central government, or some central government agencies, or whether I have to go to clinic or go to private. These are all, again, problems which, again, I think we need to get some big time speakers to discuss these things. This has opened up a huge area, Vidya. I think there are many sessions we need to, and we need to address each of them in this forum. Although I think there is a good beginning to this mentor and mentee or discussion. I think we need to have a couple more in this direction. Vidya.
Yes. One thing we'd like to tell you is that we hope that our Marvelous Medicine website, we are going to we are hoping, we've had almost 500 faculty, and the reason I'm telling you is that you can reach out and people will answer is because though I did not reach out to them for mentorship, people I didn't know from Adam or Eve have responded to my WhatsApp messages when I've invited them to come and speak on Marvelous Medicine, for which nobody gets CME points, nobody gets any trophy, it's not even part of any organization like Indian Society of Anesthesia or whatever, IASG or whatever it is. People who don't know, and not that I am any, not that I'm going to be able to do anything for them. Despite that, when I reach out to people whom I don't know at all, they actually reply back, and they have all given us some fantastic sessions in Marvelous Medicine. So I'm just trying to say that do not hesitate to reach out to somebody or drop an email, or you can always link saying, I got your number from this person, or this person told me that you may be able to help me, some prelude like that. But so what we hope to do on a Marvelous Medicine website, which is www.marvelousmedicine.in with one L, is that we will have a list of mentors, volunteer mentors, and we will have their LinkedIn profiles also there, and some of them may even be fine with actually sharing their CV. The rest we will put their LinkedIn profiles, and these people are all actually open to being mentors. So very soon we will try to categorize them and make so that okay, this is an ophthalmologist, this person works in the US in industry, that person works in Middle East in something else or whatever, or this person is doing research in this topic. We'll try to categorize that, but soon you will have a whole list of prospective or volunteer mentors who email IDs or whichever way they prefer to be contacted will be available to you, and you can drop an email, and obviously they're all busy people, they're not going to reply to your email the next day, but yes, so that is what we hope to do in the future. And Kaveri, would you like to speak a little bit, maybe 2 minutes on beyond residency, just to give a sense of what you hope to do and how you think the survey is going to help you continue with that work?
Yeah, Beyond Residency is a forum. It's an AIMS alumni initiative. It was started about a few months ago. We've already had one session, and this is our second session. And I was very keen to find out the need first and then to address it. And like Dr. Radhakrishna has mentioned, the MBBS need is very much a felt need. Though our applicants, 90% were residents and MCH and DM students, and they also needed 85% needed the mentorship. So I think the need is there. We just need to figure out how. And I do agree that they have to approach the mentor rather than the mentor seeking the mentee. So yeah, very, very important points have come out. We've given our email ID as well. And I must thank you, Vidya, Dr. Radhakrishna, to give us this forum and such a fantastic discussion, and the mentees who have given their points, the other delegates who gave their important points. And I think we have a long way to travel, but it's a beginning. And I'm very happy and very much interested to take this forward. Thank you once again for the opportunity.
Thank you. Your closing comments, Dr. Sujay?
Ma'am, I just reiterate what Kaveri said, that we thank you for sharing the platform and opening our eyes to the quite a vast field that we have encroached upon. Hope to make it more meaningful in the subsequent sessions whenever we get the opportunity. Thank you again.
Thank you for making that time. Ram, your closing
Yeah,
comments?
Vidya, yeah. I just wanted to say that, in fact, most teachers are subconsciously doing some mentorship along the way. It's not that we are just, there's no isolation between teacher, coaching, and mentor. I think some of us have that ability to mentor, and we are already doing it in a small way. And I have a slightly different opinion about, having mentors outside your place of work, because I think you need mentors for different reasons. Of course, you talked about a matrix kind of mentorship. So for certain aspects of your career or your life, you can manage with a mentor who's outside your field of, with whom you're not interacting every day. But if it comes to a professional decision regarding what specialty you want to do, what super specialty you want to do, I think you need somebody who's observing your work all the time and able to, as I mentioned earlier, identify the weaknesses more than the strengths, so that they give you the right direction and you don't make a wrong decision on that. And there's only I don't know how many youngsters are there here, people who are doing MBBS who are still before the internship level. I just want to reiterate the fact that the statement that when you enter internship, enter it with an open mind. I think there is no discipline that is not good. I think you need to, it's just like you go to a hotel, there are 5 dishes placed in front of you. You can't say which dish is good till you taste it, right? So I think you need to, in a way, taste every discipline and, see how you will fit into that discipline. And then you will be happy for the rest of your life. Thank you, Vidya.
Thank you, everybody. We are extremely sorry that we overshot time by very, very big margin. So thank you, Dr. Kaveri, Dr. Sujay, Ram, and all the youngsters who, decided to stay on, though we booked your slot only till 9:30. If any of the youngsters want to have a closing comment, please go ahead. Shaurya, Siddharth, Snigdha, anybody? You have to have the last word.
Ma'am, can I add a few points?
Okay.
I'm not sure if I'm a youngster or an elderly person. Sometimes sometimes I'm identifying myself with the mentees and sometimes with the mentors. That was such a wonderful discussion, and it's very nice to hear personal insights from very senior people. So I respectfully differ with few points, like 40 is not a very old age to get mentored, because people like us can definitely be mentored by people like Vidya ma'am, Ram sir, Hari sir, and others. Because this is a place, I feel we are in the crossroads where we have accumulated skills, experience, but then we don't want to, sometimes we are in a fix to know which direction to take that would suit us well. Like somebody rightly said, you need mentor for different mentors for different reasons. Like I fall back to Bala sir for a lot of advice. I fall back to somebody from my previous institution for clinical advice because they have observed me. Like Ram sir said, they know my strength and weakness. They can guide me on clinical decisions, which I can safely execute. At the same time, I'm also in a position to take up mentorship. Like Sir said, unconsciously, subconsciously, we are giving small mentorship to younger people. Like at least 2 people I have persuaded to come to anesthesia, where they have been dissuaded to not to take anesthesia because the competition is very high. So I had to put them a few points. I don't know whether it was right or wrong, whether they're going to blame me, curse me, or thank me later in their life for that. So that was one thing. And Ram sir, like you said, if somebody hasn't figured out in the internship what they want to do, I think it is not for them to be in MBBS. But I didn't figure out till I went for my second counseling. I took MD microbiology, and in the second round, I took TA in JNMC Belgaum. And every part, and like somebody mentioned, each institute has something to offer. It is up to us to take up what we want to do, use the clinical material wisely. I did my undergraduation in a less volume center, but then what I learned there has stood by me still now. Like Sir said, I would go to surgery, I'd go to anesthesia, I'd go to orthopedics. I was a petite female, but then I did great in orthopedics that they said I should take up orthopedics. Like I loved everything, and whatever I learned in other fields stands by still. Like it has greatly helped me. Like Amrita, you have persuaded me to look at research as a very serious thing. So I think for people
Mentee
like us, we
turning
still
mentor,
need mentors.
Amrita. Mentee turning mentor.
So I think I am in that phase also. We are in a position to give whatever we have come across, that experience, to people who are much younger than us, like a decade younger than us. At the same time, we want seniors like you all, who have decades more experience to guide us rightfully. So we would like mentorship to mentor also, to be a mentor.
Yeah, that is something we'll definitely take up. Actually, I was hoping that Professor Stephen from St. John's would be able to join. Like I said, I was doing some homework, listening to some videos, and I heard this fantastic lecture that he had given some 5-6 years ago on mentorship. So I thought we should have him today. But then I think it's good because we can have a separate session with him about mentorship training and a little more details of how to actually respond to all these needs that the mentees have put forward. So we hope to have another session sometime in the coming months. Thank you, everyone. We'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.
Good night and thank you.
Siddharth can come to GI
Shaurya wants to add something.
all time.
Shaurya wants to add something.
I just want to invite Siddharth to GI surgery OT.
Sure.
If Sujoy sir allows.
Siddharth, now you'll have competition. Everyone will want to invite you to their OT.
Thank you. I'm so privileged to be.